All right. Well, you know, holiday travel can be a pain in the neck. Literally, millions of people are getting ready for the busy holiday travel season, but sitting in a car or on a plane for too long can cause some back problems. So Dr. Jeff Pruski of 3R Regenerative Repair and Relief in the Woodlands is here to help. Thanks so much for coming in.
Thanks, Denise. Thanks for having us.
Yeah, so first off, tell us what we need to do to prepare for travel.
Well, you know, one of the big things is when we first get ready for travel, it's what we can do even 24 hours or 48 hours ahead of time, particularly if we're doing long distance drives or transatlantic flights, is to stay hydrated and make sure you get plenty of rest, because many times with, you know, there's layovers or things, but you don't get sleep, so we want to make sure everybody's rested and hydrated, because that way the body can be effective in the way it needs to be able to handle the long periods of sitting and lifting and things like that.
And so what are some things we should avoid during travel as well?
Well, you know, one of the big things, the fatigue factor sets in with the body when we're not able to maintain our normal posture alignment, whether it be standing or sitting. So that's one of the things we really stress. And the other thing is when we're immobile for a prolonged period, if you're in a small space on a plane or in a car, we want to make sure that even though you're in a small place, we want to make sure that you have proper alignment on your neck and your lower back, so you take undue stresses off of your spine as well as your hips. So you're otherwise you're kind of like holding on like you're like a bird on a wire. Otherwise we want you to be more relaxed.
And you know what, so you brought in some props here to help. Tell us about some of these.
So we have several things here. One of them, if you're traveling in a car or even on a plane, you know, you want to be able to support your neck. Many times they give you the pillow, and people always put the pillow right behind their head, which kind of pushes the head forward. But we want to really work on accentuating the curvature in the spine and the neck. So a pillow like this, or even the pillow that they give you for your head, you can put behind your neck to keep the alignment in basically an extension. We call it a lordosis.
Okay.
It's the same thing for the lower back area as well, and we have some really nice things for that can be deflated. It's a little like an exercise ball. Can be completely deflated, or you can blow it up to halfway or a full way depending on what you're wanting to do with the ball. The ball can also be used for support behind the neck or also in the lower back region.
Nice. I like
and then
that.
Depends on, you know, every contour of every seat in a car or if you're traveling with other people, it's not your vehicle, you can't really prepare for it. You can just bring this little ball, deflate it, put it in your carry-on luggage, or just slip it in the back seat of the vehicle, and you can adjust it. You can take the bigger ball and you can use that for like a little active exercise to keep mobility going. Even though you can't get out of the car, you can still move a little bit, which hydrates the disc and keeps the body moving the way it should move.
Okay, and so we're talking about car and air travel. What other advice do you have when traveling by plane?
Well, you know, one of the things like this bag, we always say, particularly if you have shoulder problems or lower back problems, it's always better to bring smaller bags, or even, you know, ones that have a handle that can extend far and have wheels, so we can roll with that.
Right.
I always recommend checking the bags in if you can. If you can't and you need to carry the bag on, always ask an attendant that's there.
Good idea, yeah.
Say, hey, can you help me with this bag? And they'll be more than happy to help you. But then you can put the bag above the without aggravating your shoulder back. Yeah, so for an individual that has that problem, kind of be prepared for that. But those are the big things that we like to see patients do, is to bring little props and little things that you can do that can go a long way.
All right. Well, thank you so much. We appreciate all the good advice.
Well, thank you. Thanks for having us.
All right, Sally.